Dr. Vora, we are good to go.
All right. Thank you so much, Hernan. Good morning, everyone. My name is Race Vora. I'm the interim health officer with the Fresno County Department of Public Health. I'm joined today by Dr. Simon Paul, who's the health officer for Madera County Department of Public Health. And we called together this meeting because we wanted to share, a couple of things that we learned about measles related to a person who resides in Fresno County, but it affects both counties. And we wanted you to, hear the story from us and let you know what we're doing on behalf of keeping our communities safe. So earlier this week, Fresno County received lab confirmation that an adult individual tested positive for measles. His risk factors were that he was not vaccinated with the measles vaccine and also had international travel. So I know that there's a lot of other news circulating. There's, other measles cases that I'm sure you may be aware of. But this individual's risk factor was international travel. He got sick, in the middle of last week. He presented on Friday evening to a local health facility. And then that's where the diagnosis, and workup got started. And then we were able to track and follow him. Thankfully, he's doing pretty well. He is recovering. He's quarantining at home, and he's getting really good care and following, all of our advice and recommendations. So I think that is a really good piece of news. Obviously, it triggered us to ask a lot of questions about, what other sort of exposures and contacts this individual might have had. The health facilities, to their great credit, really did a wonderful job protecting the other patients and staff. And we really think that the risk to the general public is minimal as a result of this one case of measles exposure. But measles is really contagious, and that's something else that we really want to let everybody know, that if people are not vaccinated against measles, that really puts them at high risk whenever they're around someone that has the measles infection and whenever that patient is actively contagious. Let me pass it off to Dr. Paul just to share a little bit more about this story and also, what we're doing from the two departments and also with our partners from CDPH to help with the rest of this response. Go ahead.
Great. Yeah, thanks. No, we've always had good communication with Fresno, and they got in touch with us immediately on Saturday because it turned out the person had attended a fairly large faith-based convention in Madera County. So over the weekend, we got involved immediately working with them to sort out, how to contact people to let them know they could have been exposed. And the group has been extremely helpful. They have attendee lists, WhatsApp groups, and so everybody who was at that convention has been able to be notified. And it turns out that the majority of the attendees were actually in Fresno County. So even though the event took place in Madera County, Fresno County is going to be taking the lead and following up on anybody who was at the event who has questions. But the one thing to remember is, even if you're at the event, if you've been vaccinated, you're not at risk. So you're really out of the woods there. And by far, most people have been vaccinated. In Madera County, the rates are like 96% of school-age kids are vaccinated. And that's probably about the same in Fresno County and surrounding counties. So almost everybody there has been vaccinated. They're not at risk. They're fine. Two things to remember. One is when we talk about measles, so it's the same thing. So if you're trying to check your vaccine history of your child's, look for the MMR vaccine. That's the measles one. But the other thing to remember is the problem with measles is it's extremely infectious. And even with a 96% vaccination rate, if you have an event with 200 people, if 96% are vaccinated, that means there's 8 people who are not. That's just in the general population. So when you have events with large numbers of people or somebody going to a large venue, even though most people are vaccinated, you can still have a fair number of people who could be at risk for contracting measles. And the other big group of concern is infants don't get vaccinated until they're, 12 to 15 months old. So infants between age 6 months when the mom's immunity wears off and 12 to 15 months when they start getting vaccinated, any infants that are exposed are at high risk as well. So that's really who we're looking for as far as contacts at the event are people who know they were not immunized or infants or somebody who's, immunosuppressed for medical reasons who might be at higher risk. So that's, like I said, we got in touch with them immediately after we got notified by Fresno County. The majority of contacts and the follow-up is probably going to remain mostly with Fresno County's Department of Public Health, even though, like I said, the event was in Madera.
Yeah, I really appreciate the partnership. Both departments have teams deployed doing the hard work of tracing those contacts, making sure that they have good information, really tracking down their vaccination status, and then really trying to sift out if there's someone at high risk. Then we're going to obviously pay more close attention to them and really make sure that they have all of the advice that they need to keep themselves and their families safe. And to make sure that if there are other cases, that we pick those up as soon as possible. So I think that that's kind of the order of the day today. Again, our teams are hard at work, just making sure that we've reached out to everyone. In general, like Dr. Paul said, like I said earlier, the risk to the public is minimal. It's very low because we have excellent vaccination rates in the state of California. But this is also a reminder that if you're not vaccinated, it's not too late. And really, whatever it takes, we really want to help you get the information that you need to make sure that that you can get vaccinated. The health department is able to do vaccinations. A lot of pharmacies and primary care clinics. Really, there's a lot of different ways for you to go ahead and get your vaccination, or even just to get tested. And maybe you could talk a little bit about that. Like, what if somebody says, "I'm just not sure. I don't really keep track of my vaccination, so I'm just not sure if I was vaccinated or not." We have a diverse population here in the Valley, so they may come from other countries, et cetera. What would you advise someone, Dr. Paul, about how they can figure out if they're actually immune or have been vaccinated for measles?
Yeah, one can try and track down one's records. I doubt I would be able to track down my records, to be perfectly honest, as I went to multiple schools in multiple states. One can do, and what the hospital does to make sure our staff are immune to measles and viruses, you can do a blood test. It's a simple blood test. It'll measure if you have protective levels of antibody to measles. And that, for many people, is easier to do if they need proof that they're immune to measles than trying to track down their records from the distant past. However, record keeping is much better than when I got my vaccines. So actually, it's quite surprising how many people can get their vaccine records from their employer, from their schools in the past. They keep those records for a long time. So you can track it down either way. Oh, and one other point which I wanted to mention before I forgot is international travel. Like if you're going to be traveling, that's a really good time to make sure you are vaccinated. And especially if you're traveling with infants, because you can feel like your infant is completely up to date with all their vaccines. You begin their appointments, getting all the shots whenever they're due. And you may not realize that if they're 11, 12 months old, they still are not vaccinated for measles. So if you are traveling with an 11 or 12-month-old overseas, you can get them vaccinated earlier than we normally do it. They might need a later catch-up vaccine because it was given so early, but that's much better than taking a child overseas who has not been immunized. So really think of that if you're traveling. We tend to think we're immunized to everything. But if you're going overseas, that's a good time to check with your doctor. Do you need any vaccinations before heading over there?
Yeah, and international travel ends up being, quite a risk factor for unvaccinated babies, adult individuals, et cetera. We had 2 cases of measles in 2023 that we confirmed with lab diagnosis. And those 2 cases were related to international travel. You've heard about other cases around the state and around the country related to that. And there's really, unfortunately, a lot of countries around the world that have measles outbreaks right now. And so, that's where being a smart traveler really will pay dividends, because you want to make sure you understand what the risks are, especially with the spring season, the summer season. Everyone wants to take trips. Make sure you know what the health risks are about where you're going, and vaccinations is really an easy way to check that off your list and keep yourself safe. Great. I mean, we could do a deeper dive into, measles, et cetera. But in the interest of time, I know that you've got a busy patient schedule today, Dr. Paul, as well. So let's open it up to some of our partners and see if they have any questions. I'm not sure exactly how to do this. We may have to do it through the chat, or our PHC team can advise us if there are questions coming from our media partners. But speaking of partners, Dr. Paul said something that I just really want to highlight, which is that our schools and our hospitals and our employers that are ensuring people are vaccinated are really solid partners in public health for us. And we really appreciate that, because that's why it's great vaccination rates, in California, is because our schools, hospitals, and employers all work together to make sure that we're keeping people safe and keeping good records, so that, if you've got a school-age child in the state of California, then, unless you've had some sort of, exemption or some other situation, then you've basically gotten your vaccine. So that itself is just a real public health success, the partnership that we have with all of our different schools and other agencies.
Yeah, just looking at the questions in the chat, there was one about if you get titers and if they're not adequate, what do you do? And that's actually pretty complicated. The first issue is if you don't have titers, maybe you didn't get vaccinated. So if you're not absolutely certain, then you should get vaccinated, because lacking titers suggests you weren't. If you have very low titers, it depends on the illness. Some things like varicella, if you know you got the varicella vaccine and you don't have titers, I believe that's one they say you still have probably adequate immunity, because there's other kinds of immunity than just the titers. And I don't believe they recommend revaccinating. But the biggest issue is if you don't have titers, you should get vaccinated, because maybe you thought you did and you didn't. And if it's borderline, then it's discuss it with your primary care provider. And the guidelines are complicated. It depends on the illness, but they don't always recommend revaccination. Like some things like hepatitis B, if you don't have titers, you should get revaccinated. Others like varicella, if you don't have titers, I don't believe they recommend doing it. But it's the kind of thing I look up and double check if that happens. It doesn't happen very often.
Great. Couple other questions. When did the event take place? The event was on Sunday, March 2nd. So that's, again, the event organizers have been really great. They've really helped us to kind of pinpoint the individuals that might have been exposed. And so that has really helped us to craft our contact tracing plan. That also touches on another question about the flight itinerary for this person with the international travel. And it turns out that they were not infectious at the time that they were flying. So the flight and the travel, et cetera, it really is not that relevant to this case in particular. Obviously, things are a little bit different with other cases that are going on in the state of California, where airport passengers, et cetera, have been informed. In this case, it was felt that that was not necessary, just because the infectious period didn't coincide with the dates of travel. Great questions. Oh, will somebody be speaking about it in Spanish? Well, in addition to Dr. Paul's excellent Spanish skills, we also have Leticia Berber, and I think that Letty will be happy to do a Spanish language interview, and I'll let Letty chime in if she wants to do that concurrently or afterwards. We totally don't mind. And then got a couple other questions, but I'll see if that answers your question. Okay, do we have vaccination rates for Fresno County right now? We will track that down for you. Fortunately, in Fresno County, we're doing very well with vaccination rates above that 90%. But really, staying above 95% represents a challenge. And I think that goes back to one of the other questions that came up about vaccine misinformation. So, there's a lot to talk about with that. Unfortunately, that is a constant challenge, is to make sure people have good advice about vaccination. Simon, how do you kind of approach this large topic of vaccine hesitancy, even vaccine misinformation? And what can we tell our communities to let them know about the safety and the efficacy and the decades of track record of success, especially with the MMR vaccine?
Well, there's two parts to it. I mean, if I have a patient who's hesitant about any vaccine, whether it's the flu shot or MMR, or I don't have a lot of child patients, so I don't spend a lot of time talking with parents about whether their kids get vaccine. But it's really just addressing what their concerns are and what have they heard and what information is there out there to address it. And one thing that always crosses my mind is, if you're worried about people have side effects vaccines, well, they might be the people who get even sicker with the illness, right? Like, that's always crossed my mind. So the side effects are extremely rare. The vaccines have been around for a long time and extremely safe. And I think people have also forgotten how sick you can get with these illnesses, right? There aren't a lot of people now who remember seeing people with measles. Even a lot of people's parents now are aging out of the time period when measles was common. But if you've seen somebody with measles or had measles, you're very motivated to get vaccinated. And I think that's pretty common with any illness or disease. If you haven't had symptoms in a long time, if you haven't seen the disease in a long time, you start wondering more about the side effect of the medicine for your diabetes rather than the symptoms you get from diabetes. So it's very common when we haven't seen an illness for a very long time that people start to wonder more about the vaccine than about the illness. And I think to me, that's the most important thing to get across. People aren't really questioning polio vaccine because people still remember how horrible polio can be. But measles, people haven't seen that in a while, and there aren't these graphic images of people in iron lungs, so people start to wonder, well, maybe it's not so bad, and I don't need to get vaccinated. But if you talk to people with measles, and I haven't talked this case, I don't know how sick they were, but most people are like, wow, I really wish I hadn't gone through that. And so to me, it's figuring out what people's concerns are, answering those concerns, and making sure they have the full picture. What are the risks and what's it actually like to be dealing with one of these infections, either for yourself or for your kids.
Yeah, agree. I mean, I remember seeing one of the patients from our last measles experience in 2023, and they just looked so ill, and I felt so bad for the family, and it's a very miserable infection, even if people recover. And unfortunately, there's a lot of complications. I mean, that's really what we're talking about is, kids need to get hospitalized. Adults can also just have a really terrible trajectory with measles. And we're also aware of the fatalities that have precipitated from measles infection. So it really is a serious illness. And like Dr. Paul is saying, perhaps we're just not as aware of what the risks are of not being vaccinated and then getting this infection or having it spread in your community. I really read a great blog earlier today about just vaccine hesitancy, and it just taught me a lot because they really made the point, which I think is very true, that it's not just one kind of monochromatic, monolithic, anti-science sentiment. Different people have really different legitimate reasons that they're not currently vaccinated, and I think all of us that are in the business of keeping people safe and educating them really need to speak to people about exactly what that issue is. Sometimes it's just really they don't want to deal with the healthcare system. It's complicated. It sometimes costs money. There's access issues, trust issues, and so a lot of non-vaccination results from just that desire to bypass healthcare access. Some people just really are into a lifestyle related to just natural healing, living naturally, etc. And there too, that's very respectable. Obviously, everybody wants to have a healthy, natural lifestyle. But part of living in nature is also the recognition that there's microbes out there that are very dangerous. And I think that really, I think making sure that people are aware of all of the things that nature brings, good and bad, might at least help them think differently about how much of that natural risk that natural lifestyle might bring with them. And then the third thing, and I think the most important thing, is that sense of control and agency. And I think a lot of people that are opting out of vaccines are really just kind of exerting a sense of agency and control over their bodies, which is something we all support. It's just in this case, it might be counterproductive because when you get so sick that you have to seek out care, or when your child gets hospitalized, then obviously that's the exact opposite of having agency and control. So again, these are all important, complicated issues. It's really hard to craft good slogans, good kind of bumper sticker sound bites about them. I think we just need to have some good heart-to-heart conversations from trusted messengers, whether that's your own personal physician, whether it's credible leaders in the community, educators certainly, and all of our partners in the media. I think we really need to meet people where they are because not everyone has the same reason for not getting vaccinated. But if they understood the very large bulk of evidence that really shows the safety and efficacy related to vaccines, I think that they would make that choice and go ahead and get that vaccine. So just some thoughts about vaccine. I know somebody had asked about all of the misinformation and vaccine hesitancy, and it's certainly something that weighs on my mind and something that we do try to address. And whenever we have cases like this, knock on wood, it won't become an outbreak, but certainly we're doing all of the steps that we need to make sure that we're tracking the exposures as carefully as possible. But whenever we have experiences like this, whether it's a single case or several, then it really just brings home the point that we all need to work together to protect everyone and answer everyone's questions so that they feel safe with the vaccine recommendations.
And just looking at the chat, two random things to mention. Also, if you're worried your child, if they have a fever and a rash and you're worried they have an infectious viral infection, always call ahead before walking into a facility and let them know so that they can make sure they put you in a room where there's isolation so nobody else gets exposed. There's a question about the exposure, kind of the incubation window for measles, and that's important. So if, for example, for the convention, if it was on March 2nd, people tend to become infectious 7 days afterwards. So people would be, if they're at risk for getting sick from measles, if they're exposed and not immune, they'd technically be recommended to quarantine for 21 days after that 7-day window. So, March 9th, people could be becoming infectious and they'd have to quarantine until 28 plus 2, basically the end of March, because there's a 3-week window where you can get sick. And that's a pretty long time. And it's interesting because if you have measles, you get out of isolation sooner than somebody who's been exposed. Because if you have measles, you're out after a certain number of days after the rash. But if you were exposed, we don't know if you're going to come down for measles till actually 4 weeks, 28 days after that exposure date. So we have a while to go to watch people after this exposure on the 2nd.
Great, thank you. Tim asked about, hi Tim. Tim asked about measles cases in 2024. And, our data shows that there were no measles cases in Fresno in 2024. And I don't know if you have that readily available. I think it's also available.
I don't remember any since I came here 5 years ago. So
we can track that down, Tim. The state keeps really good records statewide about measles cases. So.
Okay, that way we don't have to. Okay.
All right. Any other? Sorry, we're trying to scroll through the chat and talk at the same time. And
there's a question about how often you need to get the vaccine. So the vaccine related to measles is the MMR vaccine. 1 dose is great, but 2 doses is what's recommended. 2 doses is like 97% protective, and it lasts a lifetime, so you don't have to redo it. There were some age windows. People in the sort of 1960s had a vaccine that wasn't as effective, supposed to get a booster dose. But for anybody in recent times, I think since like 1976, they get 2 doses and they're protected for life.
Yeah, they've also got a different vaccine now called MMRV, which adds the varicella or chickenpox protection as well. So, but they're both great for protection against measles, which is what we're talking about today. So MMR or MMRV are either one of those is fine to help. And the clarification for how the person got infected. The person did not get infected at the event. They got infected, from their international travel. And then they were incubating the virus, but they were not contagious at the time that they flew. And then they became infectious once they were already in Fresno. And unfortunately, that infection window coincided with the event. So I don't know if hopefully that helps for Brianna, who asked that question. I know someone also asked about the exact place where they traveled. We're not going to disclose that. And honestly, it doesn't matter because there's so many countries that have measles epidemics right now. We just want everyone to know, again, we're telling our providers any international travel is considered high risk. You really should cross-check with, report global epidemics, like on the CDC website, for example, or other websites, because a lot of countries, unfortunately, are dealing with measles epidemics. And beyond that, the lack of vaccination is another risk factor. And obviously, the person has physical exam findings, and then laboratory findings is the best way to confirm. But, a lot of things have to line up for us to make this diagnosis of measles. And the international travel, regardless of the place, is just one of the general risk factors that we take into account.
Another important point that people haven't asked, I mentioned it's a faith-based convention, but it's not a group that has any objection, any problems with kids getting vaccinated. So it's not that we're thinking this is a particularly high group for an outbreak to occur in.
Yeah, thanks for sharing that. Can we talk a little bit about vitamin A? Again, a challenging topic to discuss, somewhat controversial, but I really feel, again, one of the other hats that I wear is with poison control as a toxicologist, and I just have to give my little soundbite about vitamin A. So here we go. Vitamin A has been shown to help with some cases of measles, mostly in malnourished populations overseas. So that's where, whenever you read the guidelines for measles infection, and please correct me if I'm wrong, Dr. Paul, but whenever you read the guidelines for measles infection, there is this recommendation for really severe cases to get vitamin A therapy, because these cases, A, tend to be in places where malnutrition is a real problem, and B, it's pretty benign in the dose that's recommended, which is just 2 days of dosing for even a very sick child, okay? That should not be extrapolated to mean vitamin A will prevent or cure measles. Like, that's not what that means. So please don't think that, oh, I'm not vaccinated, but I'm just gonna start taking vitamin A. That's a really bad idea, because it turns out chronic vitamin A supplementation can lead to toxicity. And vitamin A toxicity is again, something that is pretty serious. You can really have multiple organs affected, and we don't want people to go out and self-medicate with vitamin A, thinking that this is somehow a substitute for vaccines, which it's not, and something that you should be self-medicating with if you actually even have measles or malnutrition. And really, in the US, fortunately, that's one problem that we don't tend to have, is even, with very, very sick patients, their malnutrition levels are not to the point where vitamin A is really seen as like going to be kind of like, a curative. It's still, whenever people get really sick from measles, it still requires a lot of supportive care, because there's really no good medication or antiviral that's really going to be kind of like a rescue treatment for them. That's my 2 cents about vitamin A. Please don't start self-medicating with vitamin A. But if you have any other questions about poisonings, you can always call poison control. And that's my short blurb and plug for poison control.
And I'd add to that, a lot of studies on these illnesses are done in areas where there's a lot of, disruption in the public health system. People aren't vaccinated. There's food insecurity, shortages, and people are malnourished. And for any illness, if people are malnourished, nourishment and vitamins will help them do better. But that doesn't translate into here, where people are generally well nourished. But the other piece that's important is what you mentioned, is that even if you're hospitalized with measles, the dose is 2 doses, 1 today, 1 tomorrow. It is not, take vitamin A every day during the winter, right? So it's very easy to take much more than you can. So I think it's important you brought it up, and that people realize that those studies are in areas where there's a lot of malnourishment, most of the studies, and that the dose, even when people are hospitalized with measles, is very brief. It's not something that people should be taking in an ongoing way, because you can get quite sick taking too much vitamin A.
Thank you so much. We're almost at time. I wanted to just end with maybe one more question from Tim. Tim asked, this person did end up having a visit to a local healthcare facility. So how sick did they get? And I will tell you, they felt really bad. They really got the full sort of syndrome of measles. And I'll have Dr. Paul kind of chime in on that. This is something that we quiz our medical students on and our residents on all the time. And we hope that they never see it, but we do need them to understand what it looks like. So we always kind of teach them the 3 C's, which is cough, coryza, conjunctivitis. Coryza means you have a really bad stuffy nose, and conjunctivitis means you have really, really red eyes, very intensely sort of bloodshot eyes. And the cough can be just, a very irritating, hacking cough. Many other symptoms can happen: high fever, ear infections, pneumonia, even things like viral meningitis have been described. Like I said, fortunately, this person was treated. The amazing healthcare team recognized that this was measles pretty much immediately, and then were able to get him sequestered away from other folks, so that we were able to minimize the exposures during that visit. And then Fortunately, he's recovering and doing quite well. So even though he had, a bona fide measles infection with all of those symptoms, he did recover, and he's sort of, convalescing at home right now. And that will be on the test later. No, I'm just kidding, but I think we are running out of time, and I know that Dr. Paul has to go, so we'll go ahead and conclude there. We'll definitely try to follow up either in print or with more webinars like this later in the week with any updates as they come up. In the meantime, please convey to all of your readers and viewers and the general communities that the risk to the general public currently is very low, but this is a great reminder for people to go ahead and get their vaccinations up to date. And please respond if you do get contacted by public health, because we definitely want to take care of you and your family. And we really want to make sure you have the information that you need if you are one of the people that we think are high risk and was exposed to this event. And with that, I think we'll conclude, and we'll let Letty kind of do the Spanish media questions if that works for everyone. Thanks, everyone.